Place your stabilizing hand on the lateral surface of the distal humerus of the affected arm, and the gliding hand on the medial surface of the ulna just distal to the joint line. From this position, apply a lateral glide across the elbow joint. Sustaining the glide, have the patient repeat the difficult action, making sure that it is pain-free. Place the stabilizing hand over the distal humerus, holding it down onto the treatment table with the stabilizing thumb over the radial head. Reinforcing the stabilizing thumb with your other thumb, apply a PA glide to the radial humeral joint. Sustain the glide and have the patient try the difficult action. To apply this lateral tape job, the tape is applied starting medially on the proximal forearm and tracking laterally across the joint line to anchor off on the distal humerus above the joint line. The goal of this tape job is to replicate the forces applied during the sustained lateral glide with movement. To apply the diamond boxed tape job, for each individual piece of tape applied, the right thumb holds the tape firmly onto the skin, while the left hand applies force along the length of the tape. The right index finger moves skin and soft tissue under where the tape is to be placed, in towards the lateral epicondyle. When all pieces of tape are in place, a characteristic orange peel effect should be visible on the patient's skin inside the tape lines.
To strengthen the wrist extensors, we want to first start with only eccentric loading. This can be done by using the unaffected side to bring the wrist up into extension and then slowly lowering the wrist into flexion over 6 to 10 seconds. You can progress this exercise by adding in the concentric component. To strengthen the supinator, hold onto the end of a light weight, such as a broomstick or a hammer. The movement is from the end range of supination to the end range of pronation and back. Making sure you maintain full active control of the weight. Each cycle should be between 6 to 10 seconds. To maximally stretch the wrist extensors, extend the elbow, flex the wrist and pronate the forearm. At end range, overpressure can also be applied. Hold this position for at least 30 seconds. This and all other exercises should be performed on both the affected and unaffected sides to encourage any cross midline adaptations in muscle and motor function. For a south humeral ulnar mobilization, prop the lateral side of the affected arm against the end of a wall. Using the unaffected hand, apply a glide laterally at the proximal ulna. Once the glide is in place, difficult movements can be done with the mobilization. The natural progression is to try the difficult movements without the sustained mobilizations.